we are going to talk about right now is one with both national and global significance. COVID-19 cases are seeing a gradual uptick in India and around the world. The virus has mutated, but our collective alertness must not diminish. Let's get you state-wise updates. In the state of Maharashtra, 165 COVID cases have been reported from over 6,400 samples that was tested in the month of May alone. Mumbai has recorded 95 new cases this month. 2 deaths have also been reported in the state. It's important to mention in this context that both the patients had severe comorbidities. Delhi has now 23 active cases. The State Health Minister, Dr. Pankaj Singh, said that the situation is under control but is under constant watch. In Kerala, there have been 182 cases that have been reported this month. These cases are concentrated in Kottayam, in Ernakulam and in Thiruvananthapuram. Even in Kerala, the State Health Minister has issued an advisory urging for the use of masks for elderly and those who are immunocompromised. In the state of Odisha, a 75-year-old man tested positive for COVID in Bhubaneswar. The first case in the state that has been reported after several months. His travel history is under investigation. When it comes to the city of Kolkata, 3 major private hospitals have reactivated COVID protocols. Isolation wards are being readied. Hospitals have increased stocks of kits and sanitizers. Pharmacies in the city are reporting a 15% jump in mask and sanitizer sales, and this is showing how the public is on alert. The Delhi Health Department has issued an advisory to all government hospitals, and these key directives include asking hospitals to ensure that there is adequate availability of beds, oxygen, antibiotics and vaccines, ensuring that all critical equipment like ventilators, oxygen concentrators and PSA plants are functional. They've also been asked to conduct refresher training for dedicated COVID staff, mandatory reporting of influenza and illnesses and SARI, that is severe acute respiratory infection. This has been made mandatory. Cases on the portal have to be reported. All positive COVID samples will have to be sent to the Lucknow hospital for a whole genome sequencing to monitor new variants. Now, the Delhi government is also reassuring citizens that the situation currently is under control, but public has been urged to follow all safety guidelines.
कल तक कोरोना के टोटल दिल्ली में 23 केस आए थे और वो प्राइवेट लैबों में से आए हैं। दिल्ली सरकार इसको पहले देखना चाह रही है कि ये पेशेंट दिल्ली के थे कि दिल्ली से बाहर से आए थे। हमारे सारे मेडिकल सुपरिटेंडेंट से बात हो गई है, डॉक्टर्स की सारी टीमों से बात हो रही है। प्राइमरी किसी चीज के लिए दिल्ली सरकार तैयार तत्पर है और किसी को पैनिक होने की इसमें जरूरत नहीं है।
Dr. Sanjeev Bagai is joining us live on this broadcast. He will be addressing your queries on COVID. My colleague Shivam is with us. He's at the LNJP hospital in the national capital. Adib is also with us. He's reporting from outside the civil hospital in Lucknow. Nilesh is with us. He's from the Seven Hills Hospital in Mumbai. We also have Arpita, who's with us from the Perukada General Hospital, and Imran. He's reporting live from Bengaluru. Dr. Bagai, I want to come to you. There is a question on everyone's mind. There are some cases that have been reported across cities. Why is there a sudden uptick, and is there a cause for worry?
Good morning. I think there is no cause of panic or any cause of worry. The strain which we are seeing at the present moment, especially in India, Southeast Asia, is the subgroup and sublineage or a subvariant of what we call as the Omicron. There are more than almost 1,700 strains of sublineages of Omicron. The one in India, what we are seeing now is JN.1. This is not a new strain in India in terms of diagnosis. It was earlier also diagnosed quite extensively in Tamil Nadu in October to December 2023. This particular strain is unique because it has one mutation as an extra mutation, although it has lost 24 sensitive mutations. So the one which it has gained over a period of time in terms of evolutionary process is called as a flip mutation, which is LS455. So it makes it more transmissible, but because it has lost some of the sensitive mutations, it is not that invasive or not that lethal. It's not that infective. But having said that, it is highly immune evasive. So the fallout of this clinically in terms of layman language for all the viewers is that your past vaccines are holding India very good.
Okay.
At the present moment, we don't need any revaccination. The past infections in terms of natural infections does give you cross-reactivity in terms of protection. But having said that, even a mild infection of COVID, indeed JN.1, or a subclinical infection, asymptomatic carriers, can give you a predisposition towards long COVID symptoms. So it is best to protect yourself. There is no need to panic. There is no need to run for any medication. Simple precautions. We've learned this over the last 5 years. COVID is here to stay. It's going to be in smaller parts, in small outbreaks, but we have to learn to live with it, and most important is self-precautions.
Right.
And having said that, self-precautions means if you are having any cold, cough, fever or any viral-like symptoms, immediately isolate yourself for 3 to 5 days at home.
Okay.
Don't expose yourself to others.
Right.
Avoid very, very crowded places, poorly ventilated places. And in case when you're traveling in a given close area, let's say like airports or aircrafts, do wear a mask.
Right.
Mask is going to save lives, not only from COVID, but from influenza and a host of other respiratory illnesses.
So do not panic. That's the mantra and the message that's coming in. We are also seeing the kind of preparedness that is underway. Doctor, I want you to be with us because my colleagues are also with us to get us a ground check on how cities are preparing. Yes, there are some cases that have been reported, but like Dr. Bagai is saying, COVID is here to stay. We need to learn to live with it. And one is be cautious, take self-precaution, do not panic. Shivam, you're reporting from outside the LNJP hospital. Take us through the latest updates because the Delhi Health Department has issued some advisories. What is the latest?
Definitely, Sagarika. In fact, as the doctor also mentioned, it is not very serious situation here, but we are currently reporting from LNJP. And so far, if we talk about the Delhi health authorities, they are basically focused on 3 main objects. First being the sample testing, the number of testing to identify the number of cases, and also the LNJP hospital, which has been given the duty of doing the genome test, which identifies the kind of variant. And doctor has also mentioned this is the latest variant, JN.1.
Yes.
So it will be this hospital which is supposed to tell you what kind of variant would be in the number of cases that are coming in. Second being the availability of resources, availability of medical aid. Now the detailed health advisory that came in yesterday had said that the number of beds, the number of oxygen cylinders, the number of ventilators should be in check, and they are getting restocked. Apart from that, the other part, the third crucial aspect is also the accessibility of the resources, because a lot of time there are resources available, but the common people are not aware about it. So they will be posted regularly on the online portal so that people know that which hospital has how many amount of oxygen cylinders left and to which hospital.
So one major aspect at this point of time becomes letting people know about the availability of resources and also keeping them aware of the precautions that they themselves can observe at home, while also ensuring that there is adequate preparation in the medical system as well. Doctor, coming back to you, that was my colleague Shivam, who's reporting from outside the LNJP hospital. But we're talking about some common symptoms that some people are reporting. What are those common symptoms? And also, as a doctor, are you advising? That is one question many are asking. Is it time to mask up again?
Yeah, so 2 parts to your question. First is the symptoms of COVID versus influenza versus any other upper respiratory or upper respiratory infection are exactly the same in the first 2 to 3 days. It includes fever, headache, body ache, mild rash, nausea, vomiting, sore throat, cold and cough, runny eyes, watery eyes, fatigue. The important thing here to differentiate between COVID and anything else, that means JN1 versus anything else, is if your symptoms persist for more than 48 to 72 hours, if your fever is high, if you have any loss of taste or loss of smell sensation, or indeed you have ongoing fatigue, consult your doctor. The important message here is the best thing to do is to isolate yourself at home and take simple paracetamol. Antibiotics have no role. Any other painkillers or NSAIDs or fever medicines can be more detrimental. And antivirals at this stage are not recommended. Self-medication is not recommended. And all forms of alternative herbal or any home remedies can be more harmful. Consult your doctor, even an online consultation will give you the right path forward. With regards the preparedness, I think India is magnificently prepared in terms of health infrastructure, and it's full mark to the present government.
Right.
The present issue is because it is not that lethal, JN.1, we don't anticipate a crisis of having oxygen demand or hypoxic kind of pictures clinically, which we saw during the second wave of Delta. But it's always better to be safe, well prepared, and have protocols in place, which we already do.
Absolutely. Now let me go across to my colleague Adib, who's joining us from Lucknow. Like Dr. Bagai has said, that one, it is important to be self-prepared. We are talking about a variant known as JN.1. Adib, what is the preparedness on the ground in Lucknow? Take us through the latest.
Well, Sagrika, see Chief Minister Yogi Adityanath, if we talk about the Uttar Pradesh, CM held a meeting with the health department 2 days back, and in that particular meeting he has instructed officials to take precautions amid the rising cases of COVID-19. The CM also said that there are no new guidelines that have been so far issued by the Government of India, but we are going to follow the old pattern, and for this they have said that the health department will be doing all the necessary work, and that includes reserving at least 10 beds in each and every hospital. Right now I'm reporting from the Shyama Prasad Mukherjee Civil Hospital right here in Lucknow, and as the directions has come from the health department, at least 10 beds in each hospital throughout the states have been reserved for any COVID-19 cases. Apart from this, the oxygen plants that were built during the COVID time, the CM has also given the instructions to recheck and ensure that all the oxygen plants are in running status. So right now what we can say in Uttar Pradesh, there is no reason to worry because no cases have been reported so far, but all the necessary precautions are being taken, and especially the health department has been asked to stay on alert and to randomly check people for any kind of COVID-19 virus. In fact, they have been asked that if a patient is coming to the OPD, they should do a random checking just to be on a safe side to ensure that the COVID-19 is not spreading.
So there are 3 Ps that are constantly recurring when we talk about the latest, uptick in COVID cases. One, do not panic. So the first P to keep in mind is the word panic, do not panic. Number 2, precaution is key. And number 3, preparedness. The focus is also on preparedness. I want all of you to stay with us. Dr. Bagai, please do stay with us. We'll have to take a short commercial break. We'll be back because now our viewers want to know, do senior citizens or people with comorbidities, do they need to take any extra precautions? After the break, Dr. Bagai will answer that question. Taking a short break.